All right, Autumn, thank you. Time for our Midday Minutes. Today, my guest is Dr. Gil Farkash. I'm really excited to have you here. You're an obstetrician who's been working in the Buffalo area for over 2 decades now.
Correct.
And I'm happy to have you here because this is one of the reasons I wanted to start this segment, to talk more in depth about stories. And today we're going to be talking about a story that I aired, actually, I believe it was back in July. And I don't know if any of you recall this story, but it was about independent midwives, and they had some pretty harsh accusations about being pushed out of area hospitals. So if you could just hold on 1 second, I want to catch people up and play just a little bit of that report we aired.
Since I got to town, the number of options for independent midwifery have decreased.
Mara Winkler owns Fika Midwifery. When she opened her doors in August of 2017, there was a small pool of independent midwives in the area. Today, her practice is the last one standing.
Hospitals and insurance companies can make it difficult to run a practice as an independent midwife.
She felt the staff at Kaleida hospitals were not receptive to independent midwifery, to the point where Winkler voluntarily resigned her privileges in their hospitals a year ago. Now at Kaleida, midwives must be nurses, which is not required by state law. It also says the care provider has to be employed by Kaleida or a group medical practice. Fika says as the only midwives operating at their hospitals independently, these policies were directed at them.
So Dr. Farkash, I want to make it clear, you're not here speaking on behalf of Kaleida. So I want to let you know that, but you have had a lot of experience working with midwives over the years. So can you tell me about what it was like maybe 20 years ago when you started working with them in the area?
Absolutely, Madison, thanks for having me on the show, first of all. And yes, I've been practicing in the local Buffalo community since 1997, mostly in private practice, recently again employed by both Kaleida Health as well as general physicians. But going back to my experience with midwives, it's always been a very collaborative, collegial experience, as it should be. In the community, most of us obstetricians that I've worked with over the past couple of decades are all in support of midwives. We don't have any issues with home births, but our main goal and priority is for patient safety, both of the mothers and of the baby. The policy that Kaleida has enacted over the past few months, which I was not privy to, but I'm certainly aware of what's happened and has caused a little bit of controversy, I guess, in the midwifery community, is this whole idea of collaborative relationships between obstetricians and midwives.
And so what does that mean? Catch us up when you say that a collaborative agreement. Does that mean people have 2 healthcare providers?
No, it does not mean that at all. So if you have a midwife who is your provider, like in Ms. Winkler's case, she has patients, she sees them in a home office, and then the patients can choose to deliver either at home or in a hospital situation if they need to. The collaborative agreement, it can be a loose one, which is what I think existed in the past, and I believe that the policy that they recently instituted was that the midwives need to have a more formal collaborative arrangement, meaning that they're either employed by the hospital or by the physician. It doesn't mean that we are going to restrict how they deliver care to their patients. It just means that if the patient needs a higher level of care, meaning from a home birth to a hospital center, there is a board-certified obstetrician, gynecologist like myself and my colleagues that are there and immediately available to take action if necessary.
Are home births, do doctors who work in hospitals have a certain feeling about home births being dangerous? Are they more dangerous?
So dangerous is a tricky word. I wouldn't say they're more dangerous, but they're certainly a little bit more at risk. And what I mean by that is things can happen within minutes that can endanger both the mother and the unborn child. There can be fetal issues where the heart rate all of a sudden becomes dangerously low and doesn't come back up. You only have about 10 minutes or so to act before there's potential long-term consequences of the baby. There's maternal complications, there's a hemorrhage, which can happen either during or after the delivery. Those all necessitate immediate, sometimes surgical intervention, both for the mother's well-being as well as the baby's. So even though patients can be what I believe she said low risk, that's really more for retrospective diagnosis. Nobody's low risk in our minds until the delivery's done, the mom and baby are fine, and you come in for the 6-week follow-up.
And what we're showing on the screen now, this is me when I aired the story. I was reaching out over and over and over again to the hospital, just trying to get the other side of the story. And I don't know if I wasn't getting a response because it's a controversial topic, or what is the reason that, you know, midwives aren't working hospitals. Mercy Hospital has their midwife system there.
Correct.
But in the city, there's only, she said, she's the only midwife practice here. So why has it shrunk over the years?
I think she's the only independent midwifery practice. I'm aware that there are midwives that work for Kaleida. There's midwives that are employed at Suburban Hospital for sure. They don't have their own independent practice, but they deliver patients at suburban hospital. There were, and I'm not sure if they still exist, a few midwives that were having privileges at Oshai Children's Hospital. Again, most of them do home births. Why that doesn't exist anymore, I don't have the answer. I don't know if it's fear or concern, or maybe besides for Ms. Winkler's practice, is not a huge need for that. But certainly there are patients that really want those services. We're not opposed to it. We just want those patients to understand that if things do happen, it's very appropriate to come to a hospital for your care.
And do most of your patients, we only have a couple seconds left here, are they looking for medical intervention between, pain medication or other things like that? Or do you have patients that don't want any sort of?
I do a lot of minimal intervention births. I have doulas that I work with, the same doulas that work for FICA midwifery. So, we sometimes share patients, if you will.
Right.
And my patients, I would say half of them want interventions such as epidurals for pain measures. Nobody wants a C-section. I don't want to do C-sections, but there's times when they're medically indicated. Do we perform more C-sections than obviously patients want? Maybe, but we always do it with the patient's best interest in mind. We never do a C-section just because we feel like it.
Got it. Dr. Prakash, I'm so happy you were able to come on the show today, kind of shed more light on what that topic was and midwives and births in the area. So I really appreciate your time today.
Thank you, Madison. Likewise.
All right. We're going to be right back after this break.